If your child has suddenly developed intense anxiety, obsessive behaviors like repetitive hand washing, or uncontrollable motor or verbal tics, you may suspect that something neurological is going wrong. But often standard medical testing comes back normal, leaving you feeling dismissed and without answers for your kids. There is light at the end of the tunnel, though. The cause could be PANDAS or PANS, which are two complex disorders that are tied to infections, where our immune system gets confused and it's triggering psychiatric symptoms. The reason that these two tough health challenges that most commonly affect teenagers as well as young girls are extra tough to understand because they also create significant imbalance and dysfunction within the brain and nervous system, which means the proper care approach needs to target both the immune system and the nervous system at the same time. Getting properly diagnosed is key, but relief is possible with the right multifaceted care approach. This video is primarily for parents who are desperate to figure out why their child's personality and behaviors change virtually overnight when other diagnoses don't fully fit. You're going to want to equip yourself with knowledge on how infections, immune dysfunction, inflammation, and nervous system disruption intersect with PANS and PANDAS. So in this video, you're going to learn what distinguishes PANS and PANDAS from other neurological conditions, and how strep and other infections throw our immune system off course, leading to sudden anxiety and OCD, as well as the vicious cycle requiring both immune-based and nervous system support, as well as steps to uncover the root causes and collaboratively restore calm, regulation, and balance once again. So let's get in some basics about PANS and PANDAS. So PANDAS stands for Pediatric Autoimmune Neuropsychiatric Disorders associated with streptococcal infections. So let's break that definition down piece by piece. First, autoimmune means that the immune system mistakes healthy cells for dangerous invaders and unleashes inflammation and damages tissues and organs. With PANDAS, antibodies created to attack the strep also interfere with signals to and from our brains. Second, streptococcal refers specifically to Streptococcus bacteria, which is responsible for illnesses like strep throat and scarlet fever and more that then spark the autoimmune cascade. However, PANS, which is pediatric acute onset neuropsychiatric syndrome, can stem from other infections like influenza, mycoplasma pneumonia, or even food poisoning. But that suddenness and severity of symptoms are very, very, very similar. Let's go into that neurological component. So with both PANS and PANDAS, ultimately that impact on the neurological function, specifically the basal ganglia, which then coordinates cognition, emotions, movements, and behaviors, as well as our vagus nerve, which coordinates the body's ability to rest, digest, calm, and regulate. Which this is all why the neurological symptoms can appear so fast and bypass the detection on common medical exams. And so once things really set in, it's not just the inflammation that needs to be addressed, but also two things. One is what's called subluxation or neurostructural shifting. The other is dysautonomia. So subluxation or neurostructural shift occurs when there is an excessive and stuck tension within our neck, our upper back, elsewhere in the spine, and it leaves our nervous system stuck within that sympathetic fight or flight side, and it's almost as if we're stuck on overdrive. Dysautonomia, however, is the foundational component of these disorders. And so dysautonomia is a significant imbalance of our autonomic nervous system as well as the vagus nerve. And so we can detect and measure dysautonomia and nervous system dysregulation with our insight scanning technology, as well as a couple other tests, as well as heart rate variability, which is a keystone test within our office, especially for looking at chronic illness, sleep, tics, seizures, etc. I want to share a short few things with you on heart rate variability, what that looks like, and then we're going to get back into a little bit more of PANDAS. Just like we talked about, heart rate variability is the key measure, and it's our gold standard of measuring nervous system dysfunction and dysautonomia, as well as our overall vagal tone. So when we're looking at heart rate variability, it's essentially measuring the balance between our sympathetic fight or flight side of the nervous system and our parasympathetic. And so what we really want to see is that white little dot that you're seeing just outside of that crosshairs as close to that middle vertical line as possible. The other thing that heart rate variability measures is what's called our autonomic activity index, or where that little white dot is plotting from top to bottom. So where I usually talk about this is when we are stuck within that sympathetic fight or flight gas pedal, or if our body's pushing for recovery very heavily and there's a level of incoordination or exhaustion within the nervous system, sometimes our bodies are preemptively pumping on that brake pedal as well. So for simplicity's sake, when I talk about the nervous system, that sympathetic, overloaded, overdriven fight or flight side is what we call our gas pedal. And that parasympathetic, rest, digest in some cases, but when we're shifted too far, that's where we see high levels of incoordination, exhaustion, and disorganization within the neurological system. On that top to bottom is what we call our autonomic activity index. And so essentially, that's how full or how empty our gas tank is. And so the ultimate goal is for that white little dot to sit right up here. Happy, healthy, well-adjusted, well-adaptable, flexible, resilient, all those fun words that we love to talk about within our office. So the lower that this dot plots, the less gas is in the tank. The higher that is, the more reserves that our bodies have to handle stress. Sometimes I talk about this with the analogy of our stress bucket. The more full that our stress bucket is, the less likely that we're going to be able to handle more stress. So our bucket's overflowing, and sometimes that bucket overflowing comes with symptoms. So the less full that stress bucket is, the higher our heart rate variability, and the more likely that we're going to be able to handle more stress, tension, and be able to adapt and handle and be flexible through it. So that vicious cycle of the neurological system and our immune system becoming incredibly out of balance is what we call the perfect storm. And this perfect storm becomes a destructive domino effect where infectious illness triggers immune dysfunction, which is spurring inflammation that then disturbs neurological communication between our brain and between our body, especially with our vagus nerve. So once subluxation, neurostructural shifting, and that sympathetic dominance settles in, it then leads to more stress, more tension, and eventually more exhaustion and dysfunction. So the question that parents always ask is how to get drug-free help that then clears and stabilizes that neurological storm. So helping a child with PANDAS and PANS, those two infections that we've been talking about, requires that first the underlying neurological dysfunction and dysautonomia are addressed with neurologically focused chiropractic care. And often these cases are what we do in our office that are called intensives. So these are intensive-like programs where quite a few adjustments are made every single week within the early stages. This is important because if our nervous system stays out of balance and is sympathetic dominant, then both our immune system and our digestive system is going to be shut down, suppressed, and unable to fully rid the body of those infections, even with the most perfect functional or integrative medical approaches, diet changes, detoxes, and supplemental support. Which for these cases, at least in my office, those things are absolutely essential to be able to complete the healing process. The timing of what we add in, whether it's homeopathy or some of the biomedical approaches and detoxes and supplementation, is crucial because a lot of times they don't have the term that I typically will use is they don't have the integrity to be able to handle some of those big detox type supplementations. So we've got to calm the neurological storm first before moving into some of that biomedical approaches. So often the traditional medical route leaves parents feeling dismissed and without answers or effective action steps for that matter. And then with too many heavy medications that can just drive the infections as well as dysautonomia further down. And so we encourage our families within our office to build a multi-layered care team, specifically of neurologically focused chiropractors as well as the functional or integrative care professionals to be able to take that first step in adding the nervous system regulation care to your child's team. Comment below, send us a DM, and schedule a consultation so that you can learn more how we can help. Because there is hope. PANS and PANDAS can be put into remission so that children can regain their happy, resilient, adaptable selves. The key is persistently digging for answers and adding in that multi-layered care approach to be able to address the root cause and neuroimmune dysfunctions in full.